Which of the following would raise suspicion for thrombocytopenia? A. The patient's blood seems to clot abnormally fast in response to injury. B. The patient is excessively hungry. C. The patient appears to have a slightly pink tint in skin color. D. The patient is experiencing an increase in depressive symptoms. E. You see small bruises that appear under the skin. The answer is E. You see small bruises that appear under the skin. Thrombocytopenia occurs when the blood does not have a high enough platelet count. Slow clotting blood, increased bruising, or petechiae can all point to thrombocytopenia. Anemia, a side effect of many chemotherapeutic agents, involves which of the following? A. The blood does not have enough healthy red blood cells. B. The blood does not have enough platelets. C. The blood does not have enough antibodies. D. The blood does not have enough healthy white blood cells. E. The blood does not have enough plasma. The answer is A. The blood does not have enough healthy red blood cells. Anemia is a condition caused by the deficiency of healthy red blood cells in the bloodstream. This results in lack of sufficient oxygen delivery to tissues. Which of the following is a consequence of a carcinogen? A. Carcinogens increase the plasma membrane's permeability to insulin. B. Carcinogens permeate the Golgi apparatus. C. Carcinogens bind to the cell's plasma membrane. D. Carcinogens alter a cell's DNA sequence. E. Carcinogens detoxify protective lysosomes. The answer is D. Carcinogens alter a cell's DNA sequence. Carcinogens cause cancer by making changes to the host's DNA. They can be chemical, X. Pharmaceutical drugs, or viral, X. Epstein-Barr. Additionally, exposure to radiation has also been known to damage DNA and is another form of a carcinogen. Ethel is an 80-year-old woman who is receiving chemotherapy for the treatment of a tumor. You are the nurse taking care of Ethel, while her chemotherapy is infusing dash. A. You ask your colleague to cover you while you go to lunch. B. You practice hourly rounding. C. You elevate the extremity of venous access. D. You call the physician frequently to update him on her response. E. You check the infusion site frequently. The answer is E. You check the infusion site frequently. Chemotherapeutic agents are often very irritating to the tissue if they unintentionally travel to areas outside the vein. They can cause severe tissue loss and degradation. Patients receiving chemotherapy need to be monitored closely for signs of infiltration. Nathan received chemotherapy 24 hours ago. You instruct Nathan to dash. A. Flush the toilet twice after going to the bathroom. B. Wear gloves when preparing foods. C. Clean soiled areas 3 or more times using bleach. D. Throw away soiled sheets for 48 hours. E. Only drink bottled water for 48 hours. The answer is A. Flush the toilet twice after going to the bathroom. People receiving chemotherapy should flush the toilet twice after use for at least 48 hours to avoid exposing anybody else to the byproducts of the chemotherapy drugs. Wearing gloves when preparing foods, throwing away linens, using excessive bleach, and drinking bottled water are not necessary and do not significantly reduce risk to others.